My name is Brittney Davis, and today I'll be performing a head-to-toe assessment for the health assessment class at College of Coastal Georgia. I have Jordan Davis as my patient. Before I brought her into the exam room, we performed a full set of vitals, including her blood pressure, her height, her weight, respirations. I assessed her radial and her apical pulse. I also noted her personal hygiene as being adequate. I assessed her hearing, which was normal. I assessed her speech. I assessed her mobility. After bringing her into the exam room, I have provided adequate lighting. I've got a curtain pulled for privacy. I wash my hands before the assessment begins. As I start the assessment, I will explain to Jordan each thing that I'm about to perform. All right, Jordan, today I'm going to do a head-to-toe assessment on you. I'll explain what I'm doing as I move along from each system and let you know before I do it. So what I'm going to start off with is the head. I'm just going to first inspect your head and make sure that it's round. There's no areas of bulging or indentations anywhere. All sides look equal. Everything looks normal. I'm also going to palpate the head itself, feeling for any lesions, making sure that the scalp is freely movable. No areas of hard nodules anywhere. I'll also feel your hair and your hairline, making sure that it's smooth, noting any coarseness or fineness, noting the hair pattern, making sure it's distributed evenly, making sure that there's no alopecia. Then I'm also going to start by inspecting your face. I'm looking for symmetry, and I'll start with your eyes. They're symmetrical. The eyelashes extend outward. The eyebrows extend evenly above the eyes. I'm just going to shine my pen light and look at the conjunctiva of the eyes. So look up for me. I'm just shining a light. I'm looking to make sure that they're pink and moist. There's no paleness, no extra redness or dryness. I'm also noting the iris, the color, and the cornea. There are no foreign bodies. I'm also going to do pupil constriction. So I'll ask you to stare straight at an object on the wall, and I'm just going to look at your pupils and how they react. I'm looking at the direct and the consensual constriction in the opposite eye, and again, the direct and the consensual constriction in the other eye. Those both look very even. I'm also going to do a cover and uncover test. So I'll have you cover one eye, stare straight ahead at a fixed point. Now uncover that eye. Now cover the opposite eye. Now uncover that eye. Good. And I'm just making sure that the eyes move together. They're fixed on the same point. There's no drooping of either one of the eyes. Now I'm just going to have you follow the end of my pen light. Just kind of keep your head still. I'm going to look at the cardinal vision of gaze. So just keep your head still. I'm just making sure that her eyes move evenly together. There's no jumping or nystagmus. That looked even, there was no jumping. So next, I'm just going to look at your ears. I'm going to look at the shape and symmetry, make sure they're level with the eyes. I'm looking sure that there's no skin tags or lesions. I'm palpating the ear, feeling for hard nodules. That looks good. I'm going to look behind each ear, palpate the pinna and the tragus. No pain. Okay. And I'm actually going to measure your hearing. I'm going to do the Weber test. I'll strike the tuning fork and place it at the top of your head and let me know where you hear it. Right, left, or both ears. So tell me where you hear. Both ears? Good. Now I'll do the Rena test. So let me know when the sound disappears. I'm going to strike the tuning fork and put it on the mastoid bone. Let me know when it disappears. Okay. Now let me know when it disappears again. And that just compares bone conduction versus air conduction. Now I'll do a whisper test. So I'll have you cover one ear, and I'm going to come behind you, and I'll whisper a word, and you repeat it back to me. Purple. Purple. Okay? Now if you'll cover the opposite ear. Green. Green. Great. So her whisper test is intact. I'm now just going to go on to the mouth. I'm going to inspect your mouth. I'm looking for symmetry. There's no lesions, no cracks in the creases of the mouth. The lips are full and pink. And now if you'll just open your mouth so I can shine this light, I'm looking at the tongue, making sure that it's pink, beefy. There's no areas of cracks or lesions. Okay, now if you'll lift the tongue to your roof of your mouth, I'm looking underneath the tongue for any areas of irritation, any lesions. Okay, stick your tongue out straight, making sure that that's midline. Okay, now if you'll just open up your mouth kind of wide so I can look at your teeth. The teeth are nice and white. There's no missing teeth, no broken teeth, no visible cavities. Her gums look nice, healthy, and pink. There's no bleeding areas on the gums. Just kind of look up a little bit and say, ah. Okay. I'm making sure that the uvula moves evenly upward. I'm looking at her tonsils. I'm making sure that those are not enlarged. There's no extra redness, no drainage. I looked at the hard and the soft palate. Again, checking the color and for drainage, and that all looked very clear. Okay, I'm going to do your nose as well. I'm just inspecting the structure of your nose. I'm making sure that it's midline. There's no visible lesions. Everything looks symmetrical. Now I'm going to tilt your head back. I'm going to look at the septum. I'm just going to shine this light. I'm making sure that that's not deviated and that it's midline. There's no polyps. Nose hairs look good. There's no extra redness in the turbinates. And I'm also going to test how well you can breathe through each nostril. So I'm just going to cover this and breathe through that side. Okay. Good. And while I'm here, I'm just going to palpate the sinuses on the forehead, the frontal and the maxillary sinuses. I'm just feeling for pressure or areas of fluid buildup. No pain? Nope. That looks good as well. Okay, so now I'll move to the neck. I'm just going to inspect the neck itself. I'm making sure that it's midline. There's no lesions, no bumps, no protrusions anywhere. I'm going to feel the trachea. Make sure that that's midline as well. Okay, I'm feeling for the thyroid gland. I'm just going to push to the side. I'm feeling for any enlargement, nodules. That's midline and not swollen. I'll check the back of the neck and make sure that that's midline as well. Okay. All right. Now I'll palpate your lymph nodes. I'm going to start at the preauricular area. I'm feeling for any hard nodules that are freely movable. I'm going to the postauricular area, back to the neck at the occipital. I'm going to come up to the chin to the submental and the submandibular along the edge. I'm going to go down both sides, feeling the post-cervical chain. I'm going to feel a little deeper for the deep cervicals, and then feel for the supraclavicular lymph nodes. All right, now if you'll put your arms out to the side, I'm just feeling here for the axillary lymph nodes. Everything looks good. There's nothing hard or movable. Okay, now I'm going to do some range of motion on your neck. So if you'll just put your ear to your shoulder. Okay, now the opposite, and up and back. Very good. Okay, and now I'll assess some of the cranial nerves. So if you'll close your eyes real tight, open them up, wrinkle your forehead. All right, puff your cheeks out, and clench your teeth, and stick your tongue out one more time. Shrug your shoulders up. Very good. So that assesses some of the cranial nerves. Okay. Next, I'm going to move down to the chest. I'm just going to inspect the respirations, make sure that they're even, unlabored. I'm going to look from both sides, making sure that there's not one area that is stronger than the other, and that looks nice and even. The color of her chest looks good. Nice, pink, warm. There's no visible lesions or rashes. Okay, I'm just going to palpate the precordium, and I'm just feeling for any thrills, heaves, palpitations, and there are none present. Okay, and I'm going to go right here and feel for the apical pulse, which is about 5th intercostal space, mid-clavicular line. I'm again feeling for rate, rhythm, making sure that that's midline and not deviated to the side, which would indicate an enlarged heart. That feels normal as well. Now I will listen to your heart sounds. All right. So here I'm listening to the aorta, the S1 and S2, listening for rate and rhythm. Okay. Left sternal border, I'm listening to the pulmonic area. I'm going to go down to the tricuspid area, and then Erb's point, and then back to the mitral area, the fifth intercostal space, midclavicular. All of that sounds normal. I'm also going to listen to your carotid pulses, one at a time. I'm listening with the bell of my stethoscope for any bruit. I'm also listening for rate and rhythm, making sure that there's no swishing sounds. And I'll also listen to your thyroid gland itself, just right there in the middle. That sounds normal as well. Okay. And while I have you here, I'm going to listen to your lung sounds on the front. So I'm going to go on both sides. Just take a deep breath for me. In and out. And I'm listening to make sure there are no crackles, wheezing, no bronchi, making sure that the sounds are appropriate and that they're even on both sides. And I'm going bilaterally on each side to prepare to listen to each lung sound and compare as I go. Okay, all right. And now that I've listened to the bases of the lungs, I'll actually have you just kind of move your arms for me. There we go. Okay. I'm going to compare the lateral aspects of the lungs as well. So I'll start here, deep breath in, and then a deep breath in and out. And over here. And again over here. One more over here. And one more time over here. And those sound clear as well. Okay. And now I'm just going to percuss the lungs to make sure that the sounds are appropriate. I'm looking for dullness, hyperresonance, any fluid buildup. So I'm just going to listen to some sounds. Again, under here. And if you'll lift your arms again, I'm just going to compare the lateral aspects as well. Once again, listening for dullness, hyperresonance, or fluid buildup. Okay, so now if I can just have you kind of turn this way, I'm going to go to the back. I'm just going to start by inspecting the back, making sure that she's breathing evenly, to make sure that the skin itself looks good. There's no rashes or lesions, no sores. Okay. Now I'm just going to listen to your lungs again from the back. So if you'll take a nice deep breath in and out. And I'm comparing both sides evenly. Again, listening for crackles, wheezes, rhonchi. You should hear nice, clear breath sounds throughout all of the lung fields. Work my way down all the way to the bases. And yours sound very clear as expected. Okay, very good. Oops. Okay. I'm also now going to percuss the back just as I did the front. Again, listening for areas of hyperresonance, dullness, once again fluid buildup. So I'm going to start right here. Again, I'm going to compare both sides evenly to one another. Okay, and while I'm here, I'm also going to percuss the costiovertebral angles, which is down here a little lower. And that's right here on both sides. No pain, right? Nope. Okay. I'll also measure the diaphragm and how well it expands. So if you'll take in a nice deep breath and blow it out. Nice deep breath. And I'm just marking the area where I hear the difference. And you can breathe normal now. Okay, take a nice deep breath. And hold it. And breathe normal. Alright. I'll just measure the difference of the angle where I hear the sound, and it should be 3 to 5 centimeters, which is normal, and that's good. Okay, and I'll also just measure how well the ribs and the thoracic cage expand. So if you'll kind of just put your arms across your chest and lean forward a little bit and take a nice deep breath. I'm just making sure that my thumbs move evenly and that one side's not pulling more than the other, which both sides are symmetrical and even. Okay. All right, so now if you'll lay back, I'm going to do an abdominal assessment. I'm just going to have you lift up your shirt just a bit. And again, I'm just going to inspect the skin. Just going to check the contour. There's no areas of visible herniation, no protrusion anywhere. The skin looks healthy. There's no rashes, no scars. The umbilicus is midline and inverted. I'm going to begin by listening to your vowel sounds. I'm going to listen to all 4 vowel sounds for up to 2 minutes if I don't hear anything. I'm going to listen to the right lower quadrant. I'm listening for gurgles, any areas of hyperresonance, hyperactive, hypoactive vowel sounds. Listening to the right upper quadrant. I'm going to move over to the left upper quadrant and the left lower quadrant. Okay, all of her vowel sounds are normal. Okay, turning to the bell of my stethoscope now, and I'm actually listening midline for the aorta. I'm listening for any bruit. I'm listening to rate and rhythm. I'm going to go bilaterally to the right renal artery and then to the left renal artery. Again, listening for bruit. I'm going to go down to the iliac artery. I'm going to auscultate and then palpate that. Then to the left iliac artery. And palpate that. I'll go to the left femoral artery and palpate. And the right femoral artery and palpate. I'll also feel for the aorta. I'm going to just put my fingers midline a couple centimeters apart. I'm feeling for the palpations and measuring the width with my fingers. Okay. Now I'm going to percuss and just feel the liver borders themselves. So just relax, breathe normal. I'm just listening for where the sound changes. I'm going to mark where the edge is, where the sound changes. And mark that edge, and that's the border of the liver, which is in defined limits. I'll then percuss the spleen. Listening for sounds of dullness, hyperresonance. So if you'll roll to your side this way, actually, that gives you a little better angle of the spleen itself. And that sounds good as well. You don't want to be able to feel the spleen because that means that it would be enlarged. So you can go ahead and lay on your back. I'm just going to do a general percussion over the rest of the abdomen. Once again, listening for that dullness, hyperresonance. Once again, listening for fluid buildup or any areas that there could be masses or anything underneath the skin. Okay. Now I'm going to start with just a light palpation. I'm just going to kind of feel all 4 quadrants. I'm looking for nodules, masses, any lumps, and let me know if you have any pain. I'm going to palpate here for the liver. I'm feeling for the edges of the liver to make sure that it's not enlarged. Okay? And now I'm going to palpate for the spleen. I'm going to put my hand underneath her and kind of push forward. and palpate for her spleen, and I cannot feel it, so that's good. I'm going to do a little deeper palpation to feel for the organs such as your kidneys, a little deeper palpation. No pain, correct?
No pain.
Any tenderness?
Nope.
And again, everything's within normal limits. So we're done with the abdominal assessment. There we go. Okay, so now we'll do the musculoskeletal and the skin. So you can actually sit back up. So just hold your arms out straight for me. I'm going to inspect the skin itself. I'm looking for lesions, any nodules, any rashes. Looking at her fingernails, checking capillary refill, making sure that there's no clubbing, making sure that her cap refill is less than 3 seconds, which yours is very brisk. It looks good on both hands. Okay, I'm also going to palpate the pulses. So I'm actually going to start at the carotid. I'm going to palpate here. And I'm feeling for rate, rhythm, intensity. Okay, and I'm going to work my way down to the brachial pulse. Now to the radial pulse. The other side. Carotid. We'll go to the brachial pulse again. And the left radial pulse. Everything's even with good rate and rhythm. Okay, while I'm here, I'm going to go ahead and just do the reflexes. So if you'll just kind of rest your arm out, I'm going to just strike this little hammer, just kind of see how your arm reacts. And that's good. You want to see the hand kind of jump out a little bit. That's a normal reflex. So now I'm going to do the radial reflex. Same thing on this side. Watching again for the hand to jump, and at the wrist, that looks normal. Okay. Now I'm going to do a little bit of range of motion. So if you'll put your arms out for me, just hold them steady. Okay, I'm going to push down, and resist my push, and up. Okay, grab my hands, test your strength here. Arms out to the side. I'll push down again, push up. Very good. You can relax your arms. Okay, so now I'm going to go down to the lower extremities. Again, I'm looking at the skin. I'm making sure that there's good color. I'm looking at hair distribution. There's no areas of edema. I'm looking along the edges of the tibia for any pitting edema. I'm also looking again at the toes, testing the capillary refill, making sure that that's good and under 3 seconds. I'm going to feel behind the knee for the popliteal pulse on each side. Okay, and if you'll just bring your foot up, I'm going to feel for that tibial pulse and the pedal pulse on each side. And both of those are normal. I'll also look at your reflexes on your ankle. So if you'll hold your foot out for me, I'm going to strike the Achilles tendon here. And you want to see the foot kind of contract, so that's within normal limits. I'll switch over here. One more time. That's good. Okay. Now I'll also do your knees bilaterally, so just kind of relax your legs. And that's good. You want to see the foot kick a little bit. Okay. Now if you'll just stand up for me. Face sideways. I'm going to look at the spine itself. So just kind of lean forward. I'm making sure that the spine is even. There's no curvature, no areas where it's pulling to either side. Okay. And while you're standing, I'm going to assess your mobility. If you'll just touch your toes, bend over and touch your toes for me. Okay. You have normal range of motion. Also, if you'll do deep knee bends, so I can assess. Good job. Joints look good. Everything moves fluidly. There doesn't seem to be any cracks or soreness. Also, we'll test for if you'll open and close your mouth. I'm testing this mandibular joint. There's no popping, no, that would indicate TMJ. There's no signs of that. Okay. Also, we're going to do a couple of neurological tests. So I'll actually have you sit right back here on the stretcher. Okay, first of all, if you'll hold your foot out, I'm going to do something that's called a Babinski test. I'm just going to run the edge of this along the outside of her foot and across the top. We'll do each foot, which that's normal. We were looking for where her toes would flare out. That would not be normal and would indicate possible brain injury. All right, now we'll test. We'll actually do, if you'll close your eyes for me, and hold your hand out. I'm gonna put an object in your hand, and if you'll tell me what it is without opening your eyes.
Keys.
Okay, one more object.
Pen.
Okay, now if you'll open your eyes, I'm also gonna do cerebellar testing, where if you'll put your finger on mine, okay, and touch your finger to your nose, into my finger, into your nose, to my finger, other hand, to my finger, to your nose, my finger, to your nose. Okay, now if you'll hold your hands out in front of me and touch your fingertips to your thumb, increasing in speed. Very good. All of that's within normal limits. Okay, and now we'll do a sensory test. Okay, close your eyes, and if you'll just tell me, I'm going to take this cotton ball and I'm going to touch it in different areas along your face, your arms, your feet, and if you'll just tell me as soon as you feel the cotton ball.
Now. 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 Now.
Very good. All right, last but not least, I'm just going to observe your gait. So if you'll stand up and you'll walk towards the wall, okay, and walk back towards me. Her gait looks smooth. Now if you'll stand on your tiptoes and actually walk the same way. Very good. Balance is normal. And walk that way on your heels as well. Don't trip over your shoes. Once again, balance is normal. All right, one last thing. I'm just going to take this and I'm going to look inside your ears. Okay. The tympanic membrane is intact. It's a pearly gray and it's located at 5 and 7 o'clock. Jordan, your head-to-toe assessment went well. Everything seems to be within normal limits. Thank you for your participation.